Dr. Scott here. If you're watching this, then you are about to start a life-changing journey. I'm so excited for you. During our time together, I want to help you improve your health and your life. I want to give you the tools to take charge. This webinar is the first in a series. These webinars will be information-packed with ways to help you take control of your health and your life. So you might want to take some notes. So let's get started. Okay, so in this first webinar, we're going to talk about healthcare and the situation that our current healthcare is in. So, many of us believe that all of our health-related needs should be covered by our health insurance and things like that. So, let's get into it. So, we're talking about healthcare or sick care. Our current healthcare system is broken. In fact, our current system isn't really healthcare at all. It's sick care. Let's think of that for a moment. In our current system, your health insurance, in order for it to cover and pay, your doctor must use a diagnosis code. A diagnosis code is used to describe the disease or sickness you have. If you don't have a diagnosis, then you are not covered and your doctor will not get paid. So what that means is that you have to be sick or have a disease in order to get into the system. So our current system is really a disease or crisis care system, not healthcare. So why do they call it healthcare? Well, marketing experts tell the insurance companies that it sounds better and people don't want sick care or crisis care, they want health care. So it sounds better, and that's how we came up with the term healthcare and health insurance. But the reality is we have a crisis care and sick care system. So we have some things that we assume that are true about our healthcare. Pharmaceuticals prevent disease. Vaccines can make you healthy. So again, pharmaceuticals do not prevent disease. Most pharmaceuticals are designed to treat symptoms. Vaccines are designed to stimulate the immune system. But that's a whole other topic that we could do another webinar on. But the reality is that vaccines don't actually make you healthy. Doctors are experts in health. And really, our current training is about disease detection and treatment. So our doctors are expert in disease detection and treatment and diagnosis. You have no role in your own healing. So this is something that, we get a lot of in our media where, something is genetic. And if you guys have all attended my webinar, my health talk, then you know what I talk about, genetics. But the fact of the matter is that we want to give you your own ability to take charge of your health. Disease is either bad luck or just bad genes. So again, same thing. Trying to take that power away from the patient and put it into the doctor's hands. Hospitals are places of health and healing. And again, hospitals are a place of trauma care and treating diseases, and again, emergency medicine saves lives. So I'm not trying to say that that's bad, but again, a hospital is not necessarily a place of health or necessarily even healing. Conventional medicine is advanced. So again, I would say that conventional medicine technologically is advanced, and there's a lot of great advancements that we're making technologically. But when it comes to understanding health and really understanding how to get people healthy, it's like being in the dark ages. And again, more research equates to more cures. So again, research is very important, but again, when our research is totally focused on disease detection, disease treatment, then we're not really looking at cures. And again, a cure is assuming that there's some kind of magic pill that's going to cure things, when the reality is that disease is a state of dysfunction that culminates into a diagnosable condition. So again, our current system is broken. We're treating the end result. Things like heart disease, obesity, cancer. These are people, not just numbers. Diabetes and syndrome X is affecting a lot of people, and if you're not at your best, then you're not productive. This affects your life, and this is affecting the U.S. as a whole. That's why we have a healthcare crisis. So this next slide, I have a funny video that I think you guys can really kind of sets the stage for.
Doctor, I'm concerned about my vitamin D.
Are you having problems with your bones?
Not that I know of.
I can refer you for a bone scan.
No thank you. It is only that I read that vitamin D is also good for other things besides bones, like depression and...
If you are depressed, I will write you a prescription for Prozac.
No, I'm not depressed. But I do care about my health.
Certainly you should have a prescription for Prozac because of your anxiety about vitamin D.
I wouldn't say I'm anxious, I just want to be healthy. I read that vitamin D is also good for mood and colds and the flu.
My nurse will give you a vaccine for the flu.
But a recent Japanese study found that vitamin D works better than the vaccine.
Only crackpots don't believe in vaccinations.
I'm not against vaccinations, I'm just saying vitamin D is good for more than bones. For instance, it helps with inflammation and thyroid and...
I will write you a prescription for thyroid.
It's not that, but I read that most people don't get enough sunshine, so their vitamin D is low and that causes health problems.
Stay out of the sun.
But isn't the sun necessary for vitamin D?
Doctors do not recommend sunshine. It is a folk remedy.
Well, actually Hippocrates, the father of medicine, recommended sunshine, as did Indian and Chinese doctors for centuries.
That is not science. It's folk medicine nonsense.
They didn't understand about vitamin D, but they did make scientific observations, and concluded that sunshine helped people feel better.
Prozac will help your anxiety and thyroid will give you pep. My medicine is scientific. Only trust science.
In that case, some vitamin D researchers say that avoiding the sun may do more harm than good.
The sun causes cancer. That is science.
Actually, these researchers say that vitamin D helps protect from bowel, prostate, and breast cancer.
We don't know what causes those cancers. Probably bad genes.
But isn't it much more likely that I will die from colon cancer than skin cancer? That makes vitamin D very important.
Stay out of the sun and always use sunscreen. Sunshine will kill you.
But if I stay out of the sun and use sunscreen, my vitamin D will be low and that will increase my risk of much deadlier forms of cancer.
I will refer you to a dermatologist to examine your skin.
Okay, but what if I take a vitamin D supplement also?
Vitamins are quackery. They do nothing. A waste of money.
But vitamin D researchers are recommending vitamin D supplements.
Well, if you want to waste your money, I will write you a prescription for 50,000 units of vitamin D.
50,000? How do you know I need that much?
This is the prescription dose written in the book that tells me about prescriptions. It tells me everything about prescriptions. It is very big and the words are small and complicated.
But what if I don't need the vitamin D?
You don't need the vitamin D, you need Prozac for your anxiety and thyroid for your pep and to see a dermatologist.
But what about testing? I read there was a blood test.
I don't think so. But I can test your cholesterol. High cholesterol will kill you.
I'm pretty sure there is a blood test.
Okay, along with your cholesterol and your thyroid, I will test your vitamin D, then start taking 50,000 units.
For how long?
The big prescription book says 2 months.
And then what do I do?
The book does not say about the vitamin D, but it says to continue taking your Prozac and thyroid forever.
Shouldn't I be retested in 2 months to make sure I'm absorbing the vitamin D?
Only if your cholesterol is high. I will write you a prescription for Lipitor.
My cholesterol is fine. I was concerned about my vitamin D.
Yes, you are rather anxious. Start your Prozac immediately. Believe me, it will help you feel better.
I feel fine. I'm thinking of this as preventive medicine.
Yes, I agree. Prozac will prevent you from being anxious. And the thyroid will give you pep.
I think my pep is fine.
Trust me, I am a doctor. Alright then, your 8 minutes has expired. Nice seeing you again. Take your Prozac and thyroid every day and you will feel better and better.
Thank you, doctor.
And don't forget to stay out of the sun. Sunshine will kill you if the cholesterol doesn't kill you first.
Yes, doctor.
On your way out, my nurse will give you your flu vaccine.
But I do feel fine.
Are you sure? You look rather pale.
Okay, so that is satirical, but not too far off the mark. So, according to the World Health Organization, and they study over 100 healthcare systems of all the major industrialized countries around the world, and the U.S. ranked number 1 when it comes to crisis care. So, we have the best medical emergency care in the world. So, but here's some of the bad news. Again, if you're in an auto accident or you live in the United States and you're in the right place. But one of the points that I want to make is that just because emergency medicine saves lives, this doesn't necessarily translate to all areas of healthcare. So again, we got some bad news. In 1997, the U.S. ranked number 34 in overall healthcare. In 2000, we ranked number 37. In 2007, we ranked 48th. In 2009, we ranked 50th. So not going the right direction, are we? The U.S. ranks number 41 in life expectancy. But yet we spend more on healthcare than any other country in the world. So again, why aren't we number 1? Something is wrong. So again, changing paradigms. We've all been educated and indoctrinated or brainwashed, depending on how harsh you want to view it. But everything you've ever been told about health is blended with half-truths, generalizations, and flat-out lies. So I want you to just open your mind to the idea that many conflicting things that you've been told about aren't necessarily true. Okay? So, things like fat, right? For years, we've all been told that fat is bad and that fat makes you fat, right? But now we're all starting to learn that fat is actually very important and that fat actually makes you lose fat, and that without proper fats, we can create all kinds of health problems. So again, health-related information is very conflicting. One moment fat's bad, the next moment it's good. 1 minute whole grains are good, the next gluten is bad. I've spent my whole life working to find the truth. And the truth is that each person is different and each person has different needs. So fat is good for one person, but may not for another person. And I'm here to help you discover that truth. And this is why we need health consultants. The future of healthcare is education. And I think the concept of a consultant fits that nicely. Yes, I'm a highly trained doctor, certified nutrition specialist, certified functional medicine practitioner, board certified in integrative medicine, and I've spent my life studying diet, lifestyle, and nutrition. And I believe we need to break from the traditional doctor-patient relationship where the doctor heals you to a consultation type relationship where I help you heal yourself. This puts the power back into your hands. Again, the old model makes you dependent on the system, and the new paradigm gives the power back to you. I want to transform people's lives at the highest level. I'm passionate about addressing all these issues, and I want to change the world for the better, starting with you. I think it's important that you understand why I do what I do. So I formulated a little bit of a statement that encompasses my why. Why do I do the things that I do? I believe that there is a better way to health. I strive for the truth among the confusion. I challenge the status quo and innovate a better way. My purpose is to change the world by helping you achieve your potential. I provide cutting-edge healthcare in a manner that inspires and motivates people to make positive change in their life and the life of their family. This enables me to help people who could not previously be helped. I do this by providing patient-specific programs and services that improve your quality of life. So you're taking part in a program that is cutting edge. Together, we're going to change your life and undo the years of bad programming. I spent my life looking for the truth in all the conflicting health information out there. And some things I say may not make sense or seem contrary to what you've been told or what you believe is true. And if at any time you don't understand why we're doing the things we're doing, don't hesitate to ask questions. So be patient with yourself, take small steps. We're going to make some significant changes in your life, and these changes may give immediate results, and some may take some time to see those results. Okay, so that's just a primer. For some of you, this is information that's old news, and for some, it's starting to change the perception of our healthcare system. So keep up the good work, and I'm going to see you on the next webinar.